training video, Patterson, Eaglesoft, and periodontal disease. So when you are working with a patient, I went ahead and put my name in, and you're wanting to enter information for their periodontal status, you are going to go up here to this button, Perio. You can also go through the patient's chart, but I'm just going to go right here where it says Perio. So when you look at it, you can see that there's buccal and lingual and buccal. I have it set to how I want to probe. 1 through 16, 16 through 1, 32 through 17, 17 through 32. When you go to an office, you can do it however you want, but here at Lakeland, this is our default. Over here, you have mobility, pocket depth, gingival margin, clinical attachment loss, and mucogingival junction, and then furcation involvement. So the first things that we're going to do is we are going to put in our gingival margin. So over here you can see pocket depth, gingival margin, furcation involvement, mobility, mucogingival junction. You also see bleeding and suppuration. Suppuration's pus. So we are going to start with gingival margin. Make sure that you click on that button. If you don't click on that button, then you might be putting something underneath the pocket depth. It always defaults to the pocket depth. So if you were to go out and go back in, see how it defaults back to pocket depth? So just make sure that you start on gingival margin. So the gingival margin on each tooth may be a little bit different. Usually when we look at gingival margin, we see in the mouth with our mirror recession, okay? So it's ideal that the gingival margin be at the CEJ. So what you look for is you look in the mouth and you will see, look for recession first. So if you see recession on tooth number 1 on the facial, then you are going to put, after you've clicked gingival margin, 3 millimeters, because you'll check it with your probe. So we'll click 3. All right, we're going to go to this tooth, and we're going to say that it had recession of a 5. We're going to say this tooth had recession of a 2. Okay, so that is where the recession is. This area here, the gingival margin was right at the CEJ like it was supposed to be. So there was just, let's say, recession right on the very mesial. So we're pretending. We are going to go over here and let's say that we're going to kind of pretend that this side of the patient is swollen. And so it's higher than the CEJ. So it's not recession, but it's a fake pocket, because if they brush and floss, it can actually go back down to the CEJ in that area. So what you would do is you would click on the area, and then you would click the negative sign, and then you would put, when you probed, where that gum level was, and then all the way to the CEJ. You'd kind of feel for the CEJ. So see how it says -2? Then, because it's not really adding in, because it's a fake pocket. Does that make sense? So let's go over here. So if they were on Dilantin or phenytonin or nifedipine for seizure medication, their gums are going to be really, really enlarged. Okay? So that doesn't necessarily mean that they have periodontal disease. It just means that their gums are enlarged. So periodontal disease means that there's bone loss. Where there's the gingivitis, that's just enlarged gums, and we can get that to go down. So if they're taking this medicine, you would take your probe depth, you would kind of feel where the CEJ would be, and then you would click negative, let's say 5. -4. So over here, this is an example of if the gums are inflamed. And then over here, this is an example of if when you look in the mouth, you see recession. All right. So let's say that you went through, you did all the gingival margins. So this is where you saw recession, and this is where you saw that the pockets had severe gingivitis or overgrowth of gingiva. All right. So now we're going to go to our pocket depth. So this is where you probe no matter where you're at. You just take the pocket depth. So we're going to say 3, 4, 3, 3, 4, 3, 3, 4, 3. We're going to come over here to this example, and we're going to say 2, 3, 2, 2, 3, 2, 2, 3, 2. So when you look, the computer already does your clinical attachment loss. So it takes into consideration the recession. Okay, so it takes the pocket depth and the recession, and then it adds it together to 7, because the recession is loss of gingiva. It was supposed to be up to the CEJ. So that's actually 7 millimeters lost. Over here, when you see the pocket depth, it is showing that there was a 3, but the gingival margin, the overgrowth was a -2, so it takes that into consideration, and now you actually just have 1 millimeter of loss. Okay, so it takes it into consideration, and it does the appropriate clinical attachment loss. If you look at these boxes, you are going to see 3 squares or 3 triangles and 2 on the premolars, and then on the bottom you're going to see just 2 squares. Okay, and then the anteriors, you're not going to see anything. So with furcation involvement, that means it involves more than 1 root. Well, most anterior teeth just have 1 root. So all the teeth that have multiple roots can have furcation involvement. So we would have to then come over here to furcation involvement and click on it. And then, well, let's just click on this tooth right here. All right. Let's say it didn't have involvement on the mesial. It had it on the buccal. So here's your distal, buccal, and mesial. So you're just going to go ahead and click whichever one you want. And then you can type in that it had 2 millimeters of furcation involvement. Or, I'm sorry, a number 2 furcation involvement. Let's go ahead and click on this one. This one, if you look down here, there's 1, 2, 3, or 4. So you can only have a 1, a 2, a 3, or a 4. So I should have said this first. A 1 is when the probe just tips into the furcation, okay, very little. A 2 is it goes in about 2 millimeters in, or a little bit more, not much, maybe 2 or 3. A 3 is when you can put the probe all the way through the furcation, but when you look in the mouth, you can't see the probe go all the way through. You can just feel the probe go all the way through. A 4 is when the probe goes all the way through, and you can actually see the probe through the roots. The roots are that recessed, and you can see through. You can actually see the entire root and it going through. So I apologize. That's not 2 millimeters. I was going off pocket depth. Okay, so then let's go to tooth number 2. Let's say the distal was a 3, and the buccal was a 3, and the mesial was a 3. Let's say over here, or I'm sorry, this one, let's say that you could see it all the way through and through. So we put a 4, go to buccal, 4, mesial, and 4. Okay, so then it marks it all down. We come over here, and would just give this as the example. This is fine. Okay, so there's your furcation involvement. All right, now let's go to mobility. You do this with 2 blunt instruments, usually your mirror and the other end of the probe, and then you check for mobility. When you do that, you are going to then, when you click on mobility, you can just see it goes 1, 2, 3, or 4. 1 means it's a little mobile, like 1 to 2 millimeters. 2 is 2 to 3 millimeters. 3, it can move back and forth horizontally, back and forth quite a bit, more than 2 or 3 millimeters. And then 4 means that the tooth is actually vertically depressed. You can move it up and down in the pocket. So let's go ahead and click on this tooth over here and say that we have a mobility of a 4. So it goes right up here. Then let's say this tooth has a mobility of a 3. And this tooth has a mobility of a 2. Okay. The mucogingival junction, we will talk about that a little bit later. But if you look right here where it says bleeding, when you take bleeding points, we do this from this page. I've got to go inside because the train's coming. Hang tight. Okay. Let me go in the kids' room before everybody starts screaming. All right. So let's go down to, what was I talking about? Okay, so bleeding. Each tooth has 6 surfaces. All right, so keep that in mind. When I was doing a charting earlier, I had removed a tooth from the chart, and so that's why this one's red. So we'll just pretend that one's black and that it's still there, but that was an accident from earlier. Okay, so with bleeding, I'm going to click the button bleeding, and then I can go and click exactly which teeth that I want. Okay, and let's say I wanted to make it a little bit easier. You just click the button lock, and then you can just go, or click bleeding, lock, and then you can just go right along every tooth that you want. Any area that you want bleeding. Okay, so now that you've got your bleeding, you can see that, and let's say that there is some suppuration. This is, oh, sorry, that was bleeding and suppuration. So you see how it's maroon? So I'm going to take the bleeding off so you can see what just suppuration is. It's just yellow. So I'm going to click this tooth right here, and I'm going to, doing videos at home is so hard. I'm so sorry. Okay, so see how the bleeding is red, the suppuration is yellow, and then when you click on, stop it, Jackie. Okay, then if I want to click bleeding and suppuration, it turns maroon. All right, so let's go ahead with the bleeding. What you would do is you would take the total number of surfaces. So you would take 6 times 32 teeth. We're pretending that this one's still in the mouth. So you would take 6 times 32 and you would get that number. All right. Then you would count how many places have bleeding. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. So you would take 21 divided by 198, I think is what it is. Then you would get a percentage, and we're just going to say, I have no idea, you guys. I'm just going to make this number up. Let's say it's 32%. So then we are going to save that. We are going to go to the chart, the medical history, come down here to the forms, and we are going to go to bleeding points. And I think I said 37%, but I can't remember. Now, there's my percentage, my bleeding. The student signs, they accept. The instructor signs, they accept. And then you save. So let's go back to PERIO. So here's my PERIO. You can then go and show the comparison to the patient. You can say, look at look how much you've improved, or hey, things have kind of gotten worse. Your pocket depth, your bleeding, your suppuration has gotten worse. So what's going on? Let's go over some different patient education. Then you can go to PERIO graph, and you can go to comparison chart. And a lot of times patients love the comparison chart because you can compare and it's visual and they can see. Okay, so after that is done, you have completed all of your PERIO charting, and now you've also marked off your bleeding. I'm back here. I'm doing a video. Okay, sorry. Okay. So let's go into the medical history, and let's go to the PERIO risk assessment. Let's see if I can find that up here. Okay, PERIO risk assessment. Right here, questionnaire, okay? So we're just going to stick with PERIO because that's what we are doing. All right. So here's your periodontal risk assessment questionnaire. Cigarettes. Do you now or have you ever used the following? Cigarettes is what it's asking. Yep. Amounts per day, 15. Used for how many years? 15 years. If you quit, list what year. You go down to cigar. Do you now or have you ever used the following? Yes, you did use cigars. So then you would put yes. I can move this. Okay, then I'm going to come down here. Amounts per day, 2. How many years? 2. I'm just making stuff up. Pipe, same thing. Chewing, same thing. If you are a patient who has diabetes, is your diabetes under control? No. Okay, so we know that if your diabetes is not under control, your periodontal health is not under control. If your periodontal health is not under control, then your diabetes is not under control. Have you had any of these warning signs of diabetes? Answer yes or no. You would go through each of these. Do you have any risk factors for heart disease or stroke? Answer yes or no. Family history, high cholesterol, tobacco, high blood pressure, and obesity. The reason that we ask that is if you have heart disease and perio, those two do not go well together. Okay, they make each other worse. Are you taking or have you ever taken the following medications? Dilantin, Tegretol, or phenobarbital? So then you would say yes. Yes. If you answered yes to the question above, are you still taking the anti-seizure medication? Yes, yes. Are you taking or have you ever taken any of the following medications? Calcium channel blocker, blood pressure medications such as Procardia, Cardizemine, Narvasec, and Verapamil. Don't judge me, people. Don't judge me. Yes, it's been a long day. It's already 8:30 at night. Are you taking or have you ever taken the following medicines? Immunosuppressants such as prednisone. There we go. We're going to say yes and yes. Is there an immediate family member who currently has or had gum problems in the past? Yes or yes. So basically, if you would put yes, you're going to put it on both. If you put no, you're going to put it on both. So then you come down here, and then you sign, accept, and the instructor signs, and you accept. So the tobacco questionnaire is significant in asking your patient questions about their periodontal health, their just oral health. Okay, anytime you smoke or you put carcinogens in your mouth, chewing, it definitely has an effect on your oral cavity. But the biggest thing is when you do those things, it not only affects your oral cavity, but it affects your overall health. So then we're going to press save. Then we would go up to the notes, and then we'd double click here, and we'd say that we did the tobacco questionnaire. Okay, did I spell that right? I think there's 2 R's. I don't know, you guys. I'm losing it tonight. Anywho, okay, wonderful. No. Okay. I should have called it a day. I'm sorry. But I hope this gives you the gist of perio and how we do it on Patterson and Eaglesoft. If you ever have any questions, you can always ask me or Mrs. Hartrick or Mrs. Zamagoni or whoever is in clinic. We will gladly help you. And guess what? If we're not sure, we're just going to do our best. It's not a big deal. And I still spelled questionnaire wrong. Okay, let's try this again. I can't help it. Okay. Yes, got it. Okay.